miedo.
Coronavirus is spreading fast and
Stay home.
Going up.
Hi, this is Dr. Cameron Kyle Seidel. I want to quickly describe to the general public what ARDS is because I'm getting a lot of questions on that. All right, so ARDS is acute respiratory distress syndrome, ARDS. And it's a conglomeration of findings. It doesn't actually tell you what's going on inside the lung. It's findings that the doctors see about what's going on with the lung. The first thing you'll hear is what's called a low PF ratio. And PF ratio is essentially PaO2, which is a measure of the oxygen in your blood. And F is a measure of the oxygen that you're giving. All right, so let's say I'm giving 100% oxygen and the measurement in my blood is 50. You know, my ratio is basically 50, all right? So that's very low. So there are different measurements, basically 100, 200, 300, okay? That determines your PF ratio, you know, and the lower it is, the worse you have. So you have to have a ratio under this. That's PF ratio. You have to have bilateral infiltrates, which basically, if this is an X-ray, all right, you look and you see what's called infiltrates, which are just white stuff in the lung, all right? And lastly, it has to, there's a couple other, lastly, it has to not be explained by any heart issues. So what ARDS is a conglomeration of findings. We see that you basically have hypoxemia, which you have poor oxygenation. You're not getting enough oxygen through your lungs. You have bilateral infiltrates, so you have all this white stuff on your lung, and it's not explained by heart issues, and that is what ARDS is. However, it doesn't actually tell you, if you were to look in here, what is actually happening, and that's the problem, is that COVID does, you do have poor oxygen, you do have bilateral infiltrates, and it's probably not your heart, but calling this ARDS gets people distracted because it doesn't actually tell you what's going on. And ARDS is usually something that happens after you have some kind of process which causes a condition in your lungs which has been treated and studied for the last 20 years. But COVID, while it might fit all these things, is not caused by the same thing that caused the ARDS in the past. So that's why COVID really is not ARDS, all right? And it shouldn't be treated as such until we understand this. It all starts from here. I am confident that if we understand this, you know, and scientists and people working in technology, you know, get all their minds together, that we can figure this out. Probably won't be me, you know, or many of us who are working directly with patients, and because, you know, we don't work in that sphere, but there are many, many brilliant people, and I'm sure if they just understand and look that this was a new disease, you know, they could figure out really what was going on, you know, inside the body, and then hopefully figure out how to treat that. So that's ARDS in a nutshell, very quickly. And sorry, I forgot to explain that we are seeing in the hospital, in the ICU, we are seeing ARDS. At some point, their lungs do form and do become like the lungs we've been treating for the last 20 years. You know, the question is that a natural evolution of the disease, or is it due to lung injury from the ventilator? Now, that's not to say that we can't, you know, we can avoid lung injury. We need their oxygen levels to be high enough that people can live. And people's oxygen levels are going so low that at some point we have no other choice. So we have to put them on a ventilator, you know, to try to get their oxygen levels up so they live. So it's not that, you know, the lung injury is something that people are purposely doing or even that people can avoid, you know, but the fact is there is an answer to this question. You know, is this a natural evolution of the disease? Is the ARDS that we see after they're on a ventilator, not before they're on a ventilator, is that actually due to the natural evolution of the disease, or is it due to lung injury? And that's a very important question because if we're going to find an answer to this, scientists need to know, and clinicians and all of us working at the bedside, you know, all the decisions we make are dependent partly on that question. So we need to know that, even if it can't be avoided for now until we have an answer, and I hope we'll find an answer, you know, we do need an answer or an investigation into that question.